what is Ozempic and why is it so alluring to people in the context of weight loss?
Well, about a year ago, I started researching it because I was listening to everybody seem to be against it. Like the narrative really was a lot of clickbait, it started to sound like propaganda to me. And so when everybody goes left, I tend to like sit back and go right. It always makes me raise an eyebrow when everybody seems to be on the same page. And I started diving into the research because I didn't understand it as well as I needed to. And it turns out that it's a naturally occurring signaling peptide hormone in our bodies that is secreted throughout our bodies. And there's receptors throughout our body. So it's made in our gut, in the L cells of our gut, and it has gastrointestinal impacts of slowing down gastric motility, going into the brain and leading to feelings of satiety. Turns out it's also made in the brain. And it's made in the brain in sort of that midbrain area, more of the primitive lizard brain area, if you will. And it has all kinds of impacts in the brain that have very little to do with satiety and appetite. And that's really what got me going. What in the research was like, wait a minute, this is showing like really profound anti-inflammatory impacts in the brain, neuroregenerative impacts in the brain. And that's what got me going on the research that I've been on. I think the reason it's so alluring is because at high doses, it can crush the appetite. And you crush the appetite and you eat less, and the result is weight loss. But something people aren't appreciating is that it was originally developed and dispensed for type 2 diabetes. And yes, it has an impact when you use it on the metabolic health of the individual, but it turns out it's a peptide. It's not a drug. It's just been co-opted by big pharma because of the delivery mechanism of injectables. It's actually a peptide, just like a lot of the peptides your community is probably familiar with, like BPC 157, TB 500. Like there's different peptides out there that people use for regeneration, for different reasons, for healing. And this is one of them. It's actually got regenerative impacts, healing impacts, anti-inflammatory impacts throughout the entire body. So it's not just a Band-Aid drug that folks are using to mitigate their diabetes or their weight loss. It actually has a long-term impact and a healing impact on the body. So it's pretty cool. Like there's data going back 20 years. It's not a new phenomenon. This is just a newer version of a GLP-1, the semaglutide and tirzepatide, the Ozempic and the Mounjaro. But it's been in use for a long time, lots of safety data on it and lots of efficacy. The minute it turned into the weight loss conversation, people started losing their minds. So here we are.
So what is it about GLP-1, Ozempic? Like what does it do to the body that helps people lose weight?
A couple different mechanisms. One is that it has an anti-inflammatory impact throughout the body. So when you lower inflammation, you lose weight. A lot of obesity and the obesogenic state is due to just low-grade brewing inflammation. It messes up the metabolism in a multitude of ways. And metabolic dysfunction leading to insulin resistance drives that fire, drives that inflammation. So it addresses all of that directly. It has an impact on the pancreas to help fortify the beta cells, which secrete insulin. It helps insulin pulse correctly when needed and when used. It helps the cells be more sensitive to insulin because most Americans, like 2018 data showed that 94% of US adults are basically sitting in a metabolically busted state, meaning they're all dealing with some level of insulin resistance. And the end of that journey is type 2 diabetes. So that's a disaster. And that leads to weight gain and the obesogenic state. So anyway, it has profound impacts on that whole system of insulin resistance, metabolic health. Like it actually directly heals that whole chain of events that's happening. It decreases appetite. And so depending on what dose you use, I'm using it in very tiny little doses, but the traditional model is using it in significantly higher doses and ramping up the dose very quickly. So that way of doing it crushes the appetite, which I think is really devastating for people because they maybe are already not eating well and they're not protecting their muscle through strength training and prioritizing protein, and they're cranking a peptide that crushes their appetite. So if they're eating a lot of junk food, now they're just eating a little bit of junk food. And that's not a great path to go down either, but they will lose weight for the time being that they're on it. They'll destroy their metabolism in the process. But that's really some of the main mechanisms. And then it slows down gastric motility. So it just slows down what's sitting in your stomach for longer. And so you feel fuller for longer. So that's another mechanism. But it's got some pretty cool impacts throughout the body as well that have nothing to do with weight loss. So the conversation is always around weight loss and Ozempic, but there's so much more to this than just weight loss.
I mean, I'd love to stay on the weight loss path because I think that's what my audience would be like kind of interested more so in how the peptide kind of works. So from what I understand, like one of the biggest risk factors for cardiovascular disease, just health in general, is obesity. If obesity is the number one risk factor or one of the biggest risk factors, and then Ozempic can help suppress appetite and do some of the other things that you talked about, could that be the perfect thing for somebody who's like morbidly obese and just can't lose weight on their own? Could that help them kickstart their metabolism or kickstart some sort of motivation or progress to get them on the path of healing their body?
Yeah, absolutely. And you mentioned motivation. It works in the brain on the dopaminergic pathways in a way that allows the onus of control to be back in the individual's control. And we don't entirely understand how it works, but it really brings about a level of like control over the food that they desire to consume. So the hedonic urges get squelched. So that drive to just eat, or eat junk food or eat potentially things that are, not great for overall health and wellness or just maintaining a healthy body weight. I can't even explain it, how well it works. People message me from all over the world telling me like, I just feel normal now. This must be what normal people feel like. People who don't overeat. Like this is what normal must feel like. I feel like I'm in control finally. I'm not being driven by my hunger and driven by my whatever bad habits. Like I actually can control it now. They're studying it for alcohol cessation, for cocaine, for addiction. It's crazy how much control it puts back in the person's brain. So there's something happening in the brain there that is helpful. And then, yes, absolutely. There's so many reasons why obesity is an issue. It's not just the calories in, calories out. It's not just, eat less, exercise more. There's leptin and ghrelin and all these other signaling peptide hormones that are in the brain that control appetite. And this helps harmonize them. They get out of balance and you get resistance to them as well, like leptin resistance. And without GLP-1 in the system, those hormones don't work right. So I think of it like a jazz band, right? Like you need all the members of the jazz band to make the music melodic, to make it go. If you have a big orchestra, maybe you need a conductor. I feel like GLP-1 is like a big conductor. It's like a big lever to pull, and done appropriately, huge impact for people to finally get some semblance of control over what they're putting in their mouth. So they're getting these benefits downstream in their body where their fat cells aren't just packing it on anymore because insulin's getting regulated. But conversely, in the brain, they're getting a leg up. And I really think that some people need a leg up. Some people have the discipline to do it and others don't. And even with the best efforts, you probably have had clients like this, like they're doing everything right to the nth degree and they're still not getting the results they want. This can be a really wonderful adjunctive tool, I think, to have in the toolbox.
So from what I understand, the peptide essentially will work on these hunger hormones to help the person who is consistently overeating and can't control their appetite. It suppresses their appetite so that they can eat less and then in turn end up getting everything kind of flowing correctly and then lose weight, right?
Yes. And I think of it more as a modulatory process versus at high doses, it will definitely crush the appetite, but we don't always want that, right? We want them eating something. We want them eating good quality food. In fact, there was a study in rodents where they gave them the option of like rat chow or gave them, really yummy, like highly palatable food, like that nice emulsion of fat and salt and sugar, that bliss point, the foods that we love that we're not supposed to eat. And you would think if it was squelching the hedonic urge completely, that they would just stop eating or they wouldn't choose anything. And these rats actually ate the chow. They chose the chow preferentially over the junk food. So it's doing something that we've never seen before. And we don't necessarily know how it all works out. Like we don't have all the studies. We have some studies in rodents, we have some studies in humans, but overall it's showing a lot of promise on what it's doing in the brain. I think that's the most important part because control that downstream, everything's going to fall into line. And if you can get that inflammation down and get those cells stimulated to be sensitive to insulin, you can right the ship for somebody. So it's pretty compelling. And I think so long as a person is making optimal food choices, that's really the clincher, right? Like, I think that's the problem, is either they're not being counseled correctly by their physicians, and or they're not being compliant with it. They're just, like I said, eating less of the junk food. That's going to really land them in a bad position. But if they're working with somebody like you or the folks in your community, it's a really, really nice adjunctive tool.
So like being overweight and being obese has like downstream effects on all aspects of our health. Do you think the impacts on brain health when it comes to Ozempic are because of the peptide alone, or do you think it's because of the person's losing weight, and if they're losing weight, they're getting more metabolically healthy, and that is improving their brain health?
It's both. It's both. So it sits on receptors and does all kinds of things throughout the body, completely independent of weight loss, has nothing to do with weight loss. I got interested in it because I have psoriatic arthritis, which is a horrific, crippling disease process. And I was doing everything and nothing was getting it under control. And a tiny little dose of semaglutide and amazing results. So we know that it's independent. In fact, there was a study that came out at the end of last year. It was the SELECT study. Your listeners may know of this study. It was a big one. It was like the big cardiovascular disease study. And yes, it was sponsored by Novo Nordisk. So it was sponsored by the manufacturers of these peptides. So people wanted to dismiss it. But it showed that in those who were obese, but not type 2 diabetic yet, because they will be eventually, right? That they were middle-aged, that they had a 20% reduction in significant cardiovascular events. So that was really exciting and everybody got really excited. But the argument was, well, if they just lost weight, wouldn't that improve their cardiovascular disease risk, right? Like that makes sense. And so they just did a follow-up to it that came out a couple weeks ago that was presented. And it showed that independent of the weight loss, they still had significant cardiovascular benefit. So like they still had really good benefits on their heart and their vessels without whether they lost weight or not during the study. So that's tells us that yes, there's things happening outside of weight loss. But yes, once you start to decrease, for every inch your waist increases, they say your brain shrinks a centimeter. So yes, the obesity is driving a lot of problems, and righting that ship is going to be very helpful. But there are impacts that are totally independent of it.
We're already in this obesity metabolic health crisis, I would say, right now. I don't know the exact percentages. I mean, I've heard different percentages and they vary, within 10% of each other as far as how many people are overweight and obese, but it's a lot of US people. Do you think from a weight loss perspective, for the people that are taking it for weight loss, do you think it's going to make this metabolic health crisis we're in better or worse?
That's a really hard question to answer because I don't necessarily believe that most doctors have any clue how to handle metabolic dysfunction at the end of the day. And I know this because I was getting from my colleague. I'm a naturopathic physician and a chiropractor, and I was getting from my colleagues 20 years ago because I was running metabolic markers on everyone who walked in the door. Everyone who walked in the door got checked. And at that time, I was seeing like 80% of my patients had metabolic dysfunction to some degree. And I was like, this is a problem. And here we are all these years later, and it's a real problem, right? Like it's an obvious problem, and doctors are all doctors now are starting to realize this is a real problem, but I don't think they necessarily know how to manage it. I think that the peptide itself is a really phenomenal tool in the hands of the right people. So in the hands of somebody who's not going to abuse it themselves as a user, like we were talking off air about the people who want to lose like the last 4 pounds. And I think that the folks using it have to have a realistic expectation of it because, if somebody loses weight just by calorically restricting, but they don't lift weights, they're not going to change their body composition at all. They're just going to go from like 50% this and, 50, let's just say for ease of simplicity, like 50% muscle, 50% fat. And then they just shrink because they starve themselves, or they go keto, or any of those other interventions. They just like shrink down and they're still 50-50. Now they're just tiny. They're just a tinier version. And that's not sustainable. That's like the recipe for rebound. So I think we have that to contend with. And then we have the fact that most doctors themselves are metabolically busted and not in great shape. Like 20 years ago, I was having patients come in with notes from their primary saying, oh, we ran your labs and you've got some fatty liver, but it's fine. And I'm like, that's not fine. Like there's no part of that. That's bad. Having fatty liver is bad. And it is a sure sign of significant metabolic dysfunction, which is going to lead to a terrible place if not actively addressed. So I think that some doctors are just putting patients on this, and that's it. That's the end of the story. They're not getting counseled on nutrition. They're not being told to strength train. There's nothing in place to protect their muscle. They don't know better. And those folks are going to be left at the end of the day with less muscle mass, which we should talk about the muscle mass part, because I know that that is a big concern for people. They're going to be left in a more metabolically brittle state because they've lost muscle mass and they've gotten really thin. So when they do rebound, and they will rebound if they don't come out the other side correctly, that's going to be a disaster. So I don't necessarily know. I think we have to educate more doctors on how to handle metabolic health in their patients. And we need more people listening to nuanced content and having conversations like this so that they can just have a better understanding going into what they're doing when they're going in to use these peptides. Like, what am I getting into? How do I best? Because like I said, it gives you a window of opportunity to make changes. The other part of the fact that it's acting on the brain in a neuroregenerative process is something called plasticity, which is the brain itself will wire itself, it will hardwire itself as it's learning new things. And so this is a window of opportunity when they're on the peptide to actually implement strategic lifestyle changes, which will hardwire them into new habits. That's something no one's talking about. Like, what a cool opportunity to take that time that you're on it and really make the most of it. So when you come out the other side, if you do go off of it, you have these new lifestyle habits in place, right? Like, you've got a new way of eating, a new way of being, a new way of thinking. And I just think that that's not very often a part of the conversation. But, losing weight is like, there's no simple, it's complex, right? There's lots of variables.
I think a lot of times pointing the finger at the traditional medical system, it's hard to do, right? Because I think at the end of the day, most people know what to do. Like, most people now know they need to strength train. Most people know the value of protein, fiber, limiting ultra processed foods, managing how much they eat, getting good quality sleep, managing their stress. People know that stuff, right? Do I wish that doctors would have prescribed things like exercise and maybe like referral out to a nutritionist to people that had high blood pressure, et cetera, along with maybe having them on a medication for a period of time until that got all worked out? I mean, sure, I think that could have been a great alternative. I think the problem now is that people have a hard time formulating habits and creating change. And they see it as being super hard, insurmountable. And then on top of that, they look at where they're getting their information from, and there's so much confusion. It's like you have one social media channel being like, eat meat, no vegetables. The other person saying, eat vegetables, no meat. You got fasting. And so people are like, well, shoot, I might as well just not do anything because this is all so confusing and conflicting. So I look at it from a human behavior standpoint, in that the doctors could prescribe exercise and eating well all day, but if humans don't know how to create the habits to change, none of it matters. At least that's my opinion.
No, I totally agree. I was prescribing strength training a long time ago, and getting patients to actually implement was like, I mean, near impossible. And didn't matter how much money I would charge them. They just keep coming back with the same old excuses. So you're absolutely right. It's really, that's the part I think that is really exciting about how these peptides work in the brain, is that it, like I said, it gives them that opportunity to feel that they're back in the seat of control. It's really interesting how it happens. It's slow and steady, but all of a sudden it's almost like they wake up from a bad dream and they're like, hey, I'm ready. And then a few weeks to months in, they start asking like, hey, I'm ready to exercise. I want to move more. Plus it's anti-inflammatory throughout the body. So there's a really profound pain impact that it has, an anti-pain impact. And so you get them moving. I've always said with patients, like, if I can get your instincts on, if I can get you to stop eating the garbage and get your instincts on, you'll make better choices with your food. And once you do that, you'll want to start moving more. And then once they start moving more, that just begets more movement, right? And we get them in there. Especially once you get them addicted to the strength training and they can feel how strong they are, like, you got them. Generally speaking, you got them. And then they want to eat better. They want to hydrate. I've always said strength training was actually first and foremost, because when you start working hard on that beautiful muscle, you want to feed it, you want to hydrate it, you want to go to sleep on time. So you take care of it. Like, you start doing everything in your life to make that better. And it really helps drive new habits. But I think that you're right. A lot of people don't know where to start. They're intimidated by weights. It's a skill, right? At the end of the day, like, lifting safely is a skill, and it takes a while to learn it. and not everybody's into it. And then women think they're going to get bulky, which is just ridiculous. I'm the furthest thing from bulky. I wish I could get bulky. It doesn't matter how hard I try. So it's nuanced, but I do think that GLP-1s have a place. That's my only argument. I'm not trying to defend big pharma. I am not trying to defend Ozempic as the end all be all, but I think that done appropriately, and when I say that, I mean as part of a comprehensive treatment protocol that includes having a strength and conditioning coach, having your hormones optimized if they need to be, because that's a big part of this puzzle as well. Obviously doing I call that all the things, everything you just listed off, like that stuff's non-negotiable. And when that's addressed, and I say this because I had a lot of patients when I was in practice that when I had a big, busy brick and mortar, and when I was just seeing patients all day long, I had so many women come in who were strength training and they were eating, generally it was like the paleo diet back then. I mean, just eating a high protein, lower carbohydrate diet with a variety of nutrient dense foods. That's whatever you want to call that diet. And they were doing everything right. We had the hormones going. We cleaned up their gut. That's a big player in this is gut health, which GLP-1s actually have a really positive impact on gut health, which I know is not what you're hearing, but done right, it shifts the microflora into a better composition. And so they were doing everything right. And they're like, they were all middle-aged. That's what they had in common. They were all middle-aged and they all had about 10 to 20 pounds that just came out of nowhere, and it was all packed on their midsection. And yes, we could tell them to drink, cut the wine, cut everything. These women were cutting everything. They were living a much cleaner life than I even was. And we couldn't get the damn weight off their midsection. That's insulin resistance. That will eventually show up. Give it a year or two, that will show up on labs. That is the beginning of insulin resistance. When that midsection weight starts to come on and they start to have an increase in their waist circumference, they're looking at insulin resistance. And I'm like, damn, we got to do something about this now. That to me is urgent, because that's going to be another 10 pounds and another 10 pounds. And the beginning of insulin resistance is the beginning of cardiovascular disease. It's the beginning of so many of these lifestyle-driven illnesses that we're treating forever, in our country that everybody seems to have. So that's the nuance. And I think that GLP-1s could actually have a place there as well. Like, why are we waiting until people are profoundly overweight or profoundly type 2 diabetic? Type 2 diabetes is a disaster. There's nothing normal about that. Just because so many people have it now, that is the end of a severe metabolic dysfunctional state. That is severe mitochondrial dysfunction. Both of those are much harder to pull someone back from, is what I'm saying. It's you've trained them. It's a much harder haul than it is to take somebody who's stepping into it and be like, hey, how do we sweeten this up and make sure that we keep you on the path of health? So there's just a lot in between. And I think people, unfortunately, in this country, they don't get treatment until they're way far gone.
So from what I understand, there's a lot of talk about insulin resistance. From what I've interviewed a bunch of people about it, the common theme I hear is that weight loss is like the best thing to reduce insulin resistance.
Absolutely.
With that said, if somebody is pre-diabetic or has type 2 diabetes and is in that state that you're talking about, that's just can't manage their weight, continuing to put on weight year after year, month after month or whatever, are they like the perfect candidate to potentially try something like an Ozempic alongside some of these other modalities we've talked about, strength training, proper nutrition, sleep regimen, etc.?
I think so. And we're even finding that they're finally coming out. A group out of Italy finally just made a presentation saying we don't have to crank people up on the dose. I think that's where this has gone sideways. Was the dosing strategy in the allopathic community is hit them at, start them at this low dose and then ramp them up rather quickly. So they're doubling the dose every month and they're bringing them way up to 2.4 milligrams at the top. That doesn't need to happen. A lot of wonderful results can happen just at keeping people at the starting dose or lower. I'm using compounded at much lower doses. And I think there's a place for some of these women in particular, because I am a woman, I'm 50, and I know because I saw a lot of these women in my practice. And I got to tell you, I was in my mid 30s when I first started seeing this show up in my practice and really paying attention to it. And I would kind of in the back of my mind be like, oh, it sucks for you. Like that really sucks. Good thing I'm strength training. Good thing I don't eat that much sugar at all. Good thing I am doing everything right. Well, all of a sudden it started happening to me. It happened to me. I was 49, and the stress of the past few years of the pandemic, I was talking to you, I off camera, like I pushed back hard against that, and I took a lot of heat. And the stress of it, finally, that elevated cortisol state of so many years in a row just started disintegrating my metabolic health, like just disintegrating it. And I became that woman. I call it the thickening, like those middle-aged women that just sort of thicken up. Everything started hurting. My autoimmune disease was getting worse. And I was like, I have got to do something. That's when I started researching this peptide. So I think there is a place for it at very low doses in more people than we would realize, because we don't need them. We certainly don't want them to get way over here. Like, this is what we're trying to avoid. This is where infertility is. This is where devastating healthcare costs to the community are. This is where devastating health outcomes for the individual are. We don't need grandma to end up at 300 pounds and losing toes from diabetes. Like, why was grandma not being addressed? Now that we have these peptides, like, why are we not addressing this on the front end when we start to see glimmers of it instead of waiting till the wheels are falling off the car?
If you had a client come to you and they had type 2 diabetes, they're pre-diabetic, and let's just say they were considering taking something like Ozempic, but they wanted to do it in a way that was sustainable and that they're doing all these other right things that we've talked about. This person is also somebody they're not a gym rat. They're not in the gym currently. They're not, eating a omnivorous diet that's like rich in high quality protein, fruits and vegetables, fiber, like all the stuff that is good for them. Like, where do they start? Like, if they were coming, like, what are some of the simple habits you think they would need to develop to help them sustain this health transformation that they want to make?
Well, I'll tell you what I tell my patients. We start with walking. We just bring in like 3 10-minute walks a day. So starting with walking, we got to get moving. Maybe they're already there, right? Like, maybe they're already walking. Cutting out the ultra processed foods. You have to start getting your brain to consciously choose foods. And so it's just being aware, like, we don't need the donuts in the office. Don't go in the office. Don't go where the donuts are. Don't bring that shit in your house. Number one, like, don't bring it home. I know this is really basic stuff, but I usually would help patients do a cupboard clean out. Like, you got to throw all this garbage out. It can't be in the vicinity of, when your willpower breaks down at 9 p.m. at night, it can't be there. So no sodas in the house, none of this in the house. If you want to have any of these things, you have to have them outside of the house. Cooking at home is not negotiable. Like, you have to cook your meals at home. You have to start preparing meals at home. So that's the beginning. We got to get their sleep in check, because if the sleep is off, the insulin resistance and metabolic dysfunction will never correct itself, and it'll just continue to worsen. So we have to work on their sleep. But I'll tell you what I tell them. If you're not exercising regularly and you're not blowing off steam, I don't want to hear about your sleep issues, because we don't expect our puppies to sleep or our little kids to sleep if they haven't had proper exercise that day. So this is where the walking comes in. Like, you have to start getting some kind of movement in that you're willing to do consistently. I don't bring in the strength training piece as hard as I used to. I used to try to hit them with that off the bat. It doesn't work. I bring that in later once I start developing habits with them. They start developing good habits where they're interested in movement again. This is the real argument. Do we start the GLP-1s earlier or do we start it later? I argue that we actually start a very low dose early, because it does bring in that piece of willpower in the brain. It does really do profound things for the brain that allow people to start feeling like they can make these habits and make these changes without it being a huge, arduous task. So give them a low dose of that, get them on the program, but the program is non-negotiable. And then prioritizing protein on their plate, eat that first. I don't even take a bunch of stuff away from people aside from like the obvious garbage, right? The ultra processed carbs, but I am not as concerned, like, are you getting enough vegetables? Are you getting enough this? Like, that makes it's just a lot for people to think about, and compliance goes way, way down. So I just tell them, like, focus on a serving of protein that's like the size of your hand 3 times a day, and start there, eat that first, and just getting them there. I'll often test them for hormones early, because if you're low in testosterone, man or woman, you're going to have a really hard time getting your insulin sensitivity in check. So making sure that that's adequate. But that said, if you're packing a lot of visceral fat around, you're drinking a lot of alcohol, and you're not following the program, you're going to aromatize that testosterone into estrogen, and that's going to turn into a whole other nightmare. So, and the GLP-1s won't work. So at the end of the day, you have to do all the things, because the wonderful treatments that we have options for won't work. And so just really reiterating to the patient, like, this is just a Band-Aid and it's not actually a therapeutic unless you're putting in the work. So just getting them started on the basics and helping them where I can. If they need a little help with sleep, we have herbs for that. We have different options there, but just making sure that like they're starting to live like a human being and less like a, I don't know, I call it the like office chair syndrome where it's the fluorescent lights and the office chair and they, they get up out of their bed, they go to the couch, they go from the couch to the car, they go from the car to the desk and then back to the car and back to the couch and back to the bed and they start all over again. Like we have to break that cycle and get them feeling like a human again. And hopefully at this point their libido kicks in and they want to have intimacy more often. Like once we start getting those instinctual things going, people start doing better.
How do you see Ozempic impacting the fitness industry?
I actually think that's a great question. I think it's a friend. I do not think it is a foe. I do not think it is competition by any means, because for Ozempic to be successful, it needs the fitness industry. Like it needs the people who build muscle. So strength and conditioning coaches are a key player here. And it's funny, I was really scared of this peptide. Like I wasn't, I wanted to try it at a really low dose because of my autoimmune disease. I did have about 20 pounds I needed to get off. That was just like stress bloat, but I was way more concerned about my brain and my immune system because things were not going well there. And it was my coach. It was my strength and conditioning coach who I've trained with for years and years and years. And he was like, actually, I've got 3 different women on it and none of them are losing muscle and all of them are doing great. One of them's really interesting. Like one of them was in her 80s and she'd been very obese her whole life. She'd been on it since it came out. So about 2 years at that point, and she was having great results. She wasn't a skinny mini by any means, but she was not losing. He's like, she's not losing any strength. And I'm not as concerned about muscle mass or lean mass, I should say, as I am about strength, right? At the end of the day, we have the data to show like your strength is more important than how much muscle mass you have on your body. So especially as you age. So she was doing really well. And then he had a woman who was like kind of your typical mom who was in her 30s, who'd had a couple children at that point. I think she had 3 kids and she was just couldn't shake the weight. And all of these folks women had been training with him religiously several times a week. So they're doing the work and she couldn't shake the weight. So she had really great results, got down to, pre-pregnancy weight, was feeling really good. I think she was having some health issues that were starting to creep up from the weight. So that got resolved. And then he had a gal like me who was like, same story, had been training. I've been training 2 to 3 times a week in the gym with a coach. So not just mamsy-pamsy dinking around, heavy lifting for over a decade. And all of a sudden I'm like packing on the weight, like I mentioned, and she was having the same phenomenon as she was hitting menopause. So she lost that 10 pounds, her blood pressure regulated, and she was feeling significantly better and her mood improved because there's actually a huge antidepressant effect of these. So anyway, I was like, well, damn, that's compelling. Like my strength and conditioning coach is like the one seeing the results here. He gave me better case testimonials than any of the doctors I talked to. So I gave it a try. I think that learning about this, understanding how it works and understanding how to train your clients that are on it is like key number 1, because this peptide is not going anywhere. And people are more and more and more people are going to be on it. They're coming out with a pill version that I believe is going to be very affordable and accessible soon. The studies on alcohol abuse syndrome, I think once those go through, we're going to see more insurance coverage for these things. So I think only more people are going to be on them. There's not going to be less. And we need to know how to address these folks from all angles. And we need to embrace it and make it a positive and help them do it right so they don't waste away.
You're somebody that strikes me, like you just mentioned, as somebody who's taken care of your health for a long time. You've got the fundamentals down. You're doing all the things. You mentioned some of the other people that were working with your trainer, same kind of deal. My fear is that we are a society that is addicted to quick fixes and instant gratification. And I think, like we were talking about offline, Ozempic started as something that from a weight loss perspective was supposed to help people who are like morbidly obese. And now it's kind of turned into a vanity thing for certain people where they're like, I want to just lose the last 5 pounds, the last 10 pounds instead of, really dialing in their diet or amping up their exercise routine. Given the fact, like you said, it's not going away, what problems do you think this is going to present, like downstream, if people aren't careful, if they're using it solely as a vanity drug and they're not using it for what it's actually made for?
I think we're seeing that in some of the celebrities that are on it. They look like skeletons. It reminds me of so I'm 50, and back when I was in high school, Kate Moss, the model, came on the scene, and she just destroyed everything for women in one fell swoop because suddenly this like heroin chic look was in. And the goal was to get as skinny as humanly possible. I remember starving myself to death so that my arm up here was the same size as my wrist. Like we all just wanted, and I was in Portland. So it was like, it was a thing. Like we were all just wafy and skinny, and we wore big combat boots and went to punk rock shows, and we all looked like we were dying with circles under our eyes. So that was the mess we were all in. And I definitely don't want to see that back, but I'm seeing some of these actresses that are on it and they look like that, except now they've just are full of filler, and they've got filler everywhere and it's crazy and they look like cartoon characters. And I just, that's what I don't want to see happen, is that especially women do not understand that if you break your hip, it is the kiss of death. Men too, but breaking your hip is literally, it's so common. And when I started training, total truth, when I started training before I hired a coach, I didn't know what I was doing. I was just going to the gym all the time. And I was always showing up there like in the evening. And there was this group of trainers there, these young guys. And finally one guy was like, "What are you training for? Like, you're so diligent. Like you've got your program that I got out of like Brett Contreras's book. I was doing it. And I was looking good. I was feeling good. I was not probably doing it right, but I was trying. And I remember he was like, "What are you training so diligently for?" I was like, "The zombie apocalypse and to not break a hip." Like for real. That was for real. I meant that. And so that's what I'm training for, the zombie apocalypse and to not break a hip, because I've seen patients break hips. And if they live, most don't. Most end up with pneumonia in the hospital. Some are so severe that they're so frail that they can't actually relocate the hip. So while they're dying of pneumonia, their hip's out of joint. It's horrific. And then others who lived through it didn't really come back. Like they just weren't themselves. And the 10-year risk of death significantly goes up if you've broken your hip and survived. So that's why I've been telling people to strength. Like I'm like, deadlift and eat steak. I've been saying it for as long as I can. My mentor before me taught me that, like lift weights and eat meat. It's so incredibly important that we don't around with our muscle. And as we get older, especially us ladies, it's terrible how hard it is to keep it on. Like it's a chore to keep the muscle on. So if you're not actively fighting for your muscle, meaning you're not in the gym 2 to 3 times a week, lifting heavy, you're already losing, right? And if you're under eating on top of it with something, whether you're under eating on your own or under eating with the use of Ozempic or abusing it, you are setting yourself up for a disaster. An absolute disaster when you get older. And I think that's the problem. You're right. People want the quick fix, but they also have no concept of what the long game is. Like in their heads, there's no like, oh, in 20 years from now. And I'm always thinking in 20 years from now. Like, I don't want the fate that my father has had. I don't want the fate that I've seen my family members have. So that's one of the reasons I started training. I was just training so I went through menopause easily. These are things I think about that I don't think a lot of women especially are thinking about. And I know that some men are probably abusing it too. But I also know that in the community you're in, like a lot of these guys are just using it as an appetite suppressant just for a cut. And they know the difference. They're not cranking up the dose. They're not going overboard. Like kind of in that bro science community, there's an understanding and a respect for it. It's just when we get into the allopathic medical community where they're taking people up on crazy high doses and using it as a monotherapy, it's really devastating. So I think, if that stays the course, then the people who get sucked up into that are going to be in trouble.
And I think the people that already have good self-awareness around their health and have been in the game for quite a while, they can likely handle like using it for a cut in a way that's healthy because they've already kind of experienced. They have so much experience with that, they know that it's not going to be forever. And they have the other habits in place to help them maintain that like after they get off of it. I guess my big fear is I just look at, we're in this vanity crisis, I think, right now with filters and people editing their photos and just trying to look a certain way because they think that's what happiness and success looks like. And we also are in this perfectionist world where it's like, I just need to get a little bit better, a little bit better, a little bit better. I just see so many people potentially falling down that slippery slope with Ozempic and using it in the same way, being like, well, I've lost all this weight and I still have like a little bit to lose on my hips. Instead of maybe hiring a coach or trying to figure out like what's going on with what I'm eating or sleep or whatever, I can just take Ozempic. That'll suppress the appetite and do certain things in my brain, and that'll help me lose the weight. And then it's like then they lose the weight. They're like, I'm still not satisfied. Then you get more and more and more and more. I just think that, and I just look at it from an addiction standpoint. Like, it's like the dopamine rush you get from looking a certain way is very addictive. And we're in this world where everybody's trying to constantly edit themselves in photos and edit themselves, in their lives to look a certain way. And that's my biggest concern, I think, with this is, what's the downstream effects going to be on people's mental health? What's the downstream effects going to be for people that abuse it? Because like we said, for the person that is obese, type 2 diabetes, and needs it as like a medical intervention, I mean, it's the no brainer, right? For the person that has a long history of maybe competing in physique competitions or has great self-awareness around their health and fitness already, they've been doing it for a while, I mean, probably not going to really hurt them. But for the person that has low self-esteem and that is like sitting, at home, like wishing they looked better so they could feel better about themselves, I worry about that type of person. Does that make sense?
No, totally. I do too. I am that. I have a background of severe anorexia, like severe. So I get it. Being skinny is very addictive, and I totally understand. I'll tell you though, as somebody who's using this peptide, so I use it, I cycle it, I keep it very low, and I think the inherent impacts on the brain, that's what I keep trying to get at, is actually offsets the concern you have. And I'll tell you why. It crushes addictive behavior, which is really interesting. So addiction to all kinds of different things, foods. I've got a decent sized platform. I've had hundreds of people reach out to me since I started talking about this about a year ago and doing a series of podcasts on my own show. And I've got people saying, I'm not smoking anymore. I'm not online shopping anymore. It's curbed my sex addiction. Like, it curbs addictions. And so the addiction, I was very concerned. That was a big concern for me when I told my mom I was going on it for other health reasons. She was like, be careful. Like, I have watched you waste away too many times. And I was like, I know, Mom. I know. I really have worked so hard and spent so much money on this muscle that I do have. And I'm a pretty skinny gal that, like, I don't need to be losing that. So I have not had any issues with it whatsoever. There hasn't been a moment where I was like, I'm just going to crank the dose up and increase the nausea and just waste away. Like, I think the inherent way it works in the brain on the dopaminergic systems actually offsets that addictive abuse potential. Not in everyone, but generally speaking. And we see this in rodent studies as well. The other piece is that it sits on receptors in your brain that are nausea centers. And some people have a more robust bed of nausea of these, GLP-1 receptors in these nausea centers. So some people take a tiny little dose and get very nauseous, and other people can take I do think there's a deficiency issue we haven't even talked about, which we don't have to open that can of worms, but there is known GLP-1 deficiency. We have the data on that. We have strong data on those who are obese, those who are type 2 diabetic, and those with fatty liver have GLP-1 deficiency. People always say, like, it's not an Ozempic deficiency, Dr. Tyna. I'm like, yeah, actually it is. And I suspect that some others are low-grade GLP-1 deficient. So they need different doses, is my point. And I think that the nausea itself abates the ability to abuse it. And most of the people that I have it on, and most of the people, like, I don't have anybody who is having terrible side effects that I've got it on. And I've got a group of almost 200 people that are in my program that are all using GLP-1s, and they aren't having terrible side effects either. The nausea abates the ability to abuse it. It shuts you off. You can't go higher. I cannot even play with a tiny larger dose without feeling nausea, and I don't want that. So unless they're able to contend with that and deal with it, I just think that there are in most people, the way that it seems to work in the brain, I don't think that your concern will happen. It's not like another type of drug that you can flood the receptors and everything's great. Like you flood the receptors with this and you're in a whole lot of trouble. Your stomach shuts down and you are in pain and you feel awful. So I'm not sure. I do think low grade, long term, people could probably starve themselves to death, but there's or into that terrible, abuse place. But I think that those people have the potential to do that anyway. So I don't know. I think there's more good than there is bad. And I think that more people are going to get benefit than seeing those, sprinkling of cases where people really do waste away. And I know people are seeing it. I get messages from people like, everyone in my office looks like a ghost. They're all too skinny. They're all just eating donuts and Doritos and they're wasting away in front of me. Those people are really screwed. They're shooting themselves in the foot. They're going to be in a really bad place when they remove the Ozempic. I just think there's a way to do this correctly, and we need to have more conversations like this so that people are aware.
It seems like a lot of the people that have been following you are already like super passionate about health and wellness, correct?
Mm-hmm.
Right. So like there's only one of you. So the way the devil's advocate is, we've been doing this for decades, putting people on medication to help alleviate symptoms in the short term, hoping that they'll change behavior for the long term, whether it be medications for diabetes, high blood pressure stuff, cholesterol medication, right? And so I think the problem I see is you can't force somebody to change their behavior, right? And I think ideologically it's a great idea to be like, all right, we're going to stop the bleeding, but then it's ultimately up to the human to change their behavior. And it's like, I'm not a cynical or pessimistic person about this whatsoever. I just look at it more objectively, like, is this actually the thing that's going to force people to change their behavior? Like, are you that confident that this drug or this peptide has that strong of an impact on somebody's brain that it's going to really be the lever that needs to be pulled for them to finally like clean up their health?
I think in most cases, especially if there's proper education.
Does that make sense what I was saying?
Yeah, absolutely. And trust me, I'm a cynic. Ask my mom. Like behind the scenes, I am the queen of cynicism. I cannot believe the state of human beings' health. Like I just can't believe we've gotten here. I've watched it happen. I've literally I'm just the exact age of watching it happen. It started right after I was born, and here we are. So my daughter, who's 24, it was already in full swing by the time she came on the planet. So she can't see what I've seen, and I have been in the health space. Well, I was a very sick kid myself. So I've been in doctor's offices my entire life. And then I've been working in medicine since I was 19. So I've seen a lot. And I have never been so excited about something that could move the needle so profoundly as I am about this peptide. And I say that wholeheartedly. And I know I'll take shit for it. I have not seen anything. It's not a drug. First of all, we have to clear that up. It's not a drug like a blood pressure medication or a Band-Aid drug that you have to be on for it to work. Its impacts, like if a patient were put on it at a low dose, let's just say they were put on it at a low dose that didn't even impact their weight, they still would have profound healing benefits on their metabolic health over the course of that year. And those benefits would persist because it's a peptide. So peptides are just strings of amino acids that and strings of peptides make up proteins. That's it. So semaglutide, for instance, is bioidentical to our own GLP-1. It just is tweaked a little bit because GLP-1 naturally has a very short half-life. And like I said, a lot of people are deficient in it. A lot of people also have really messed up guts. And so their L cells of their guts are just fried out. And so they can't even make GLP-1. Or maybe they're very aged. If you're very aged, your gut lining atrophies like the rest of you. So you lose the ability to secrete the things out of your gut cells that you normally would need for good health. So anyway, given the opportunity done correctly, I think with education, I think we need group coaching in here. We need strength and conditioning coaches to get involved, health coaches. I think more people need to be educated on it. That's why I have a program where 50% of the people in that program are healthcare professionals. They're learning so that they can better help their patients, whether they can prescribe it or not. They're just in there. There's health coaches in there. There's strength and conditioning folks. There's all kinds of different practitioners that are just trying to understand this peptide better so that they can be of service to their patients who are taking it, so that those patients don't go down the bad road, the bad version we talked about. So it's nuanced, but I think it's possible. And I do think what you said is true. I think changes in the brain are so profound. It's the risk tolerance and it's the balance that we have to look at. Like, what's the upside? What's the downside? And I think people are looking at this very black and white and they're looking at it just for weight loss. That's not what it is. Like, if we don't need blood pressure medications and statin drugs and all these other things because they're on a tiny little droplet of semaglutide, like, I call that a win as a physician. If I'm pulling people off drugs, I'm happy. That's a big win for me. The more drugs I can get people off of, the better. So, and if they're making incredible changes in their lifestyle, because I really believe, I know I'm a cynic, but if you empower a person with education, when people know better, they do better. I really believe that. I really do believe that. And it's hard because I think sometimes they just need some support, and they need also something we haven't really discussed, which I mean is a whole other, Pandora's box. But like, when you're winning, when you're doing something for your health, maybe you've experienced this or your listeners have, you start to make lifestyle changes, you start to really improve your well-being, your family and your friends come for you. Like, they come down hard on you for it. And so I think a lot of people really want to try to improve their health, but they just get so much shit from everyone around them because misery loves company. So there's just so much to this conversation that I don't think Ozempic's going to fix it all for sure. But when you feel better, you do better. And if we could get more people feeling better, I think we'd be in a better state. I think a big problem that happened in the past few years was everybody went into it feeling so and in such poor health. So if we, had something where we could improve people's metabolic health, it would be a game changer.
I'd be interested if they did like some sort of study that showed they had like two groups. One took like a low dose of semaglutide and one took like a 30-minute walk outside, and to see the changes in the brain, if they were similar or different, like what would be upregulated, what would be downregulated. You talked about like one of the biggest benefits for the brain is that it helps with motivation and getting people like on the track of health and wellness. And I think walking can do the same. Like, I think you put on your shoes, you tell somebody to go for a 5-minute walk, they end up going outside and they're like, well, I'm out here already. You might as well walk for at least 15 minutes. I'm like, I didn't do all this work.
Yeah.
And then they
Walking
come back
is amazing.
in and they're like, wow, like I feel good. Or the runner's high or whatever, from people getting from exercise. I just would be interested just to see if there's any kind of correlation, similarities, because it's definitely all interesting. And I think a lot more will be revealed, right, as time goes on. I think it's important to have conversations like this and have open dialogue. I'm curious, like, I think you're not as dogmatic as some when it comes to these negative side effects of Ozempic. In your opinion, like, which of the negative side effects, other than like the overuse we talked about, should people like be aware of that you've seen?
That is a good question. I will jump in. I just wanted to say something because I love walking too. Like, I can solve all the world's problems if after a walk. If I go for a walk and deadlift, I'm like, I can fix everything. Everything's fine. Some really cool data that's come out recently. We know through the big studies that we've seen over the past few years with these GLP-1 agonists, both semaglutide and tirzepatide, significantly better outcomes in those who implemented lifestyle variables to it. So there were studies done on just taking the peptide alone, and then there were studies done on people who actually, had 150 minutes of exercise a week and had some dietary habit changes. So those people did much better and ultimately were showing better improvement as they came off. So the recent data showing that those who exercise while on GLP-1s were able to titrate off and maintain weight loss significantly better than those who didn't. So we know that the exercise component in there, because there's a pathway called AMPK that gets upregulated with the use of GLP-1. It also gets upregulated with the use of exercise and protein. And, so I think of things synergistically. I don't think of them instead of, like, the walking is non-negotiable. The other things are also a part of it. And then we add in a little bit of this to sort of sweeten the deal. I just want to make that clear because I have a different way of doing it in that I want them to do all those things. And maybe they need a little bit of this, depending on, maybe we're just using it for high blood pressure. Maybe we're not even trying to lose weight, So the exercise component, I think it's key. I think that part is, we're going to see that over the next few years when they start doing better studies and maybe things like you're talking about here. We're going to start to see that exercise in addition to is like that's the ticket. As far as the terrible side effects, so for real, if you have gallbladder issues, and again, this is if you are following an allopathic model where you're cranking the dose up. Okay, so that's a different conversation than I'm having about the way I dose it. But all that to say, if you have gallbladder issues and you crush your appetite and you slow down your digestion, you're going to sludge up your gallbladder and you're going to potentially throw a stone. That stone's going to go in the pancreas and cause pancreatitis. That is a real risk. So I get a lot of messages from people, hey, I've had a history of gallstones. Is this safe for me? And I'm like, I don't know. You need to work very closely with your physician to make sure this is not something you want to buy off the shelf off the internet. Like, you want to work closely with someone so you don't screw things up. There's a real risk of slowing down digestion. And let me go back to pancreatitis a second. The number one cause of pancreatitis is throwing a stone. The number two cause of pancreatitis is fatty pancreas. Fatty pancreas, like fatty liver, is something that happens when you are living in a metabolically busted state. And so most people who are dealing with prediabetes and obesity are dealing with fatty liver and fatty pancreas. So they're already sitting in a compromised state, and then they're cranking the dose of a GLP-1, and boom, it sends them over the edge. Also, abrupt and rapid weight loss will send somebody into a pancreatitis state. So those are all things that I think we look at them as like big scaries, but we're also seeing them in a population. The people most prone to using these peptides are those that are already at high risk for that. The other real concern, like I said, is the gastric motility. Type 2 diabetics are already dealing with some low-grade gastroparesis, whether they know it or not, because their vagus nerve is being sugared up and being destroyed slowly from the high levels of blood sugar. So many of them are sitting, maybe they've got some bloating and burping and distension, and their doctor's like, oh, here's some Prilosec, never mentioning like you're walking into permanent gastroparesis because you're destroying your vagus nerve. So that's a real concern. Again, crank those people up on a peptide and boom, they get thrown over the edge of something I believe many are already sitting on the edge of. There's concern about kidney damage. If you end up in a severely hyperemetic state because you get hit with too high a dose and it hits those nausea centers of your brain and you end up puking severely, you could run into severe dehydration and some kidney damage. Again, that's usually transitory, but the peptide itself does not cause kidney damage whatsoever. In fact, the study had to be halted at the end of 2023, the study on kidney failure, because the treatment group was having such profound results in reversing chronic kidney disease that they felt that it was unethical to not give it to the control group. So they had to stop the study. Like, it's that profoundly effective on kidney health. So I don't know. Like, a lot of this has been sensationalized, and when you actually dig into it, it's just not adding up to what the headlines are saying.
But do you think we don't have enough like human data yet though? Because people have only been really using it like intensely for the last like what, year?
No. So this is a family of peptides. So GLP-1s, exenatide goes way back 20 years. That was used pretty extensively in type 2 diabetics. Then liraglutide was used pretty extensively.
But the everyday people weren't using it like they are now though, right?
I'm sure that we've had a significant increase in prescriptions and dispensing. Yeah, for sure. So we'll see. Yeah, the volume of people using it has gone up, but the safety data on it, people did not start freaking out until the weight loss conversation came up and the Kardashians started using it. And like you said, some people started abusing it. But I've talked to so many docs who use this, and that was the first question. I called everyone I knew who was using it clinically. And I was like, is any of this happening in your clinic? And they're like, no. And some of these people are running diabetes clinics and they're like, yeah, no. And then I called my compounding pharmacist friends who are dispensing a ton of it. I'm like, are any of the patients that you're dispensing to having these horrific side effects that's all over the news? And they're like, no. So I, I don't think it's quite the sensation that it's being made out to be. I think there's an obesity bias that is inherent in our society. And the minute the conversation was like, hey, you might be able to lose weight without having to do anything, people lost their minds. And here we are. So I don't know. That's just my own personal opinion. But there's also some big industries that have a lot to lose.
True.
You know, their snack food companies are complaining, like for real concern. Their stock is down. Fast food companies' stock is down and they're complaining and they're paying attention. Joint replacement companies are concerned. Dialysis clinics are concerned. I'm wondering if big pharma companies who don't hold a patent on a GLP-1 might be concerned because you might not need all the other drugs they're selling. I found some data around the thing that's been going around the past few years, and significant reductions in death and ICU admission and pneumonia when contracting the thing and using semaglutide. So,
I mean, to be continued, right? More will be revealed, I guess, right?
yeah.
Well, Tina, this has been great. Thank you so much for coming on the show.
It was super fun. I liked all your questions. I appreciate you being, asking the hard questions because we have to have the conversation.
Yeah, I haven't covered it on the show yet. So it's like interesting. I definitely want to have a few conversations about it just to get different perspectives because I like to learn and just hear what people are saying about it. Again, like I appreciate you sharing your thoughts, your wisdom on it, what you've seen in your own life and just with the people that you've worked with on it. So thanks for coming on.
Yeah, yeah. And I have a 3-4-part video series that I go into more detail if people want to know just more data that I dug up.
Perfect. And then I guess they could just find that on your website.
Yep. It's at drtina.com. So it's all there.
Awesome. Well, thank you again for coming on. I think the audience is going to gain some great insights and value from this. Hopefully it encourages them to look further into this so that they can just be aware of what this is. Because like you said, it's not going away. So thanks again for coming on.
Yeah. Thanks for having me. I appreciate it.
Thank you so much for watching. If you like this video, I really think you're going to like this video as well. I'll see you there.